Blepharitis is something that we encounter often, very often. And you have a couple of choices as a clinician. You can dive in and try to figure it out and categorize the subtypes and be strategic about what you're asking your patient to do, or you can bury your hand in the sand. I don't recommend that last approach. So I would recommend a more proactive approach. And something that I've found to be very helpful is, we're just talking about blepharitis in a general lump term at this point, that I've switched away from a detergent-based approach and have moved more towards a normal mybum oil maintaining type approach. In other words, I think some of the detergents can be a little harsh on the ocular surface, particularly if you're dealing with an evaporative dry eye patient. Every time they have a detergent load right around the lid margin, you're going to strip away that natural oil reservoir which is needed for the precorneal tear film to prevent evaporation. So for those heavy evaporative patients, I find that just switching them away from all of their soaps and detergents around their eyes is actually very helpful. And that includes facial cleansers, Cetaphil, all of these other types of overstripping, Franken conditioning type approaches to skincare. So it involves skincare, it involves makeup, it involves a variety of things. But I like this approach of not disturbing those delicate oils that Mother Nature designed on purpose for the ocular surface. And so what I'll do, if I suspect there's a bacterial overload component, is I appreciate the use of Avenova. I find Avenova to be, or any kind of hypochlorous acid formulation that you prefer. I do think it has significant advantages that are paradigm shifting with respect to the bacterial control, with respect to not disrupting the lipid layer, and also with minimizing, which is a very important consideration, the preservative load that the eye is exposed to. So in bucket blanket terms, yes, blepharitis we have to deal with, but I favor a less is more type approach and a more restoring a natural balance that Mother Nature intended, because she's a pretty smart designer and I'm just trying to tweak things and buff it up. With respect to different varieties of blepharitis, obviously there's the Demodex, and those interventions have been well described and they're very effective and very helpful. Rosacea blepharitis is a complicated beast. It's inflammatory, it affects the oil glands, typically these patients are very sensitive to anything you put around their face anyway, so I'm even more cautious with an ocular rosacea patient or a facial rosacea patient. But yes, absolutely have to pay attention to blepharitis. It's definitely a comorbidity with ocular surface disease, and I just try to be very natural and non-disruptive to that process. I just want to restore that balance that is supposed to be there.